You go to bed exhausted, sleep for 7 or 8 hours, and wake up feeling like you haven't rested at all. Your partner says you snore loudly, or that you stop breathing for a few seconds during the night. You wake up with headaches, a dry mouth, and brain fog that lasts until noon. You've tried different pillows, sleep positions, even cut out caffeine. Nothing works. Here's what most people don't know. The position and strength of your tongue controls your airway while you sleep. When your tongue is weak or falls backward, it partially blocks airflow, causing snoring, sleep apnea, and fragmented sleep cycles. A study in the American Journal of Respiratory and Critical Care Medicine found that tongue exercises reduced sleep apnea severity by 39% in just 12 weeks without CPAP machines or surgery. Today, I'm going to teach you 5 exercises that retrain your tongue to stay in the right position and keep your airway open all night long. But first, drop your name and where you're watching from in the comments. By the end of this video, you'll understand exactly why tongue weakness affects your sleep, breathing, swallowing, and even your neck posture. And you'll learn 5 simple exercises you can do at home in just 5 minutes a day to strengthen your tongue, improve your airway, and restore the restorative sleep your body desperately needs. No equipment required, no surgery, just targeted movement. Before we begin, always consult your doctor or speech therapist before starting any new exercise routine, especially if you have dysphagia, recent throat or neck surgery, neurological conditions affecting swallowing, or any condition that causes sharp pain in your jaw or throat. Pain is not progress. Mild muscle fatigue in your tongue is normal. Sharp pain or difficulty breathing is a stop signal. Every exercise has modifications, so start where you are. So let's start with number 5, tongue to roof hold, and this is going to be your posture foundation. Most people have no idea where their tongue should rest when they're not eating or talking. It just sits at the bottom of their mouth, pressing against their lower teeth. But that's the problem. When your tongue rests low, it doesn't support your airway. It allows your jaw to drop back, and over time it contributes to mouth breathing, snoring, and forward head posture. The correct resting position is with your entire tongue gently suctioned to the roof of your mouth, especially the back third of your tongue. This position naturally opens your airway, supports your jaw, and encourages nasal breathing, which is healthier for oxygen intake and immune function. A study in the Journal of Oral Rehabilitation found that seniors who practiced proper tongue posture had significantly better airway space, less snoring, and improved neck alignment compared to those who let their tongue rest low. Here's how to train it. Close your mouth gently. Place the tip of your tongue just behind your front teeth on the roof of your mouth. Now, try to suction the entire flat surface of your tongue up against the roof of your mouth, including the back. It should feel like your tongue is gently stuck there. Hold this position for 30 seconds while breathing normally through your nose. Release, rest for 10 seconds, then repeat 5 times. If you can't get the back of your tongue to touch the roof, start with just the tip and middle. Over time, work on engaging more of the tongue surface. If your jaw feels tight, relax and try again with less force. This isn't just an exercise. This is retraining where your tongue lives all day, every day. The more you practice this position, the more automatic it becomes, and the better your airway stays open even while you sleep. Number 4 is all about tongue push-ups, and this is what I call your swallowing strength builder. When you swallow, your tongue has to generate enough force to push food or liquid to the back of your throat and trigger the swallow reflex. If your tongue is weak, food can linger in your mouth, slip into your airway prematurely, or cause you to choke. This is called dysphagia, and it affects up to 40% of adults over 60. Research from the American Journal of Speech-Language Pathology shows that tongue-strengthening exercises significantly improve swallowing safety, reduce choking incidents, and even lower the risk of aspiration pneumonia, which can be life-threatening for seniors. Here's how to do it. Take a small spoon or a tongue depressor. Place it flat against the roof of your mouth, right behind your front teeth. Now, press your tongue up against it as hard as you can, like you're trying to push it through the roof of your mouth. Hold that pressure for 5 seconds, then release. Rest for 3 seconds, then repeat. Do 10 repetitions, 2 to 3 times a day. If you don't have a spoon, you can do this without any tool. Just press your tongue firmly against the roof of your mouth and hold. The resistance from the spoon adds intensity, but even without it, you're building strength. This exercise directly targets the muscles responsible for safe swallowing, giving you more control and confidence every time you eat or drink. For number 3, we're moving to tongue side-to-side sweeps, and this is your coordination and range of motion restorer. Your tongue doesn't just move up and down. It also needs to move side to side to manipulate food, clear debris from your teeth, and maintain full range of motion. After 60, many people lose this lateral mobility because they stop using it, and that loss contributes to poor oral hygiene, difficulty chewing, and inefficient swallowing. A study in the Journal of Oral Science found that seniors who practiced tongue mobility exercises had better chewing efficiency, fewer choking episodes, and improved overall oral function. Here's how to train it. Open your mouth slightly. Stick your tongue out as far as you comfortably can. Now, move your tongue to the right side, trying to touch the right corner of your mouth. Hold for 2 seconds. Then move it to the left side, trying to touch the left corner. Hold for 2 seconds. Return to center. Do this 10 times in each direction. If you can't reach the corners of your mouth, go as far as you can without straining. Over time, your range will improve. You can also do this exercise with your mouth closed, moving your tongue along the inside of your cheeks. This movement keeps your tongue flexible, coordinated, and ready to handle the complex tasks of eating and speaking with precision. Now we're at number 2, tongue curl and press. And this is where we strengthen the back of your tongue. The back third of your tongue is the most important part for keeping your airway open during sleep. When this area is weak, your tongue falls backward when you lie down, partially blocking airflow and causing snoring or sleep apnea. Strengthening this region can dramatically improve sleep quality without machines or devices. Research published in Chest, the Journal of the American College of Chest Physicians, found that exercises targeting the back of the tongue reduced sleep apnea events by 36% and improved oxygen saturation during sleep. Here's how to do it. Close your mouth and rest your tongue naturally. Now, curl the back of your tongue upward and press it firmly against the soft palate, the soft area at the back roof of your mouth. You should feel tension in the back of your tongue and possibly a slight lift in your soft palate. Hold this press for 5 seconds, then release. Rest for 3 seconds, then repeat. Do 10 repetitions, twice a day. If you can't feel the back of your tongue engaging, try yawning first to locate your soft palate, then practice pressing that area. This takes time to develop the mind-muscle connection, so be patient. This exercise is one of the most powerful tools for reducing snoring and improving sleep quality naturally. And it works because you're directly strengthening the muscles that keep your airway open all night. And finally, number 1, tongue extrusion hold. And this is your maximum strength developer. This exercise might look simple, but it builds the kind of raw tongue strength that translates to better swallowing, clearer speech, and a more stable airway. It's also one of the most researched tongue exercises in speech therapy and sleep medicine. A clinical trial in the International Journal of Orofacial Myology found that tongue protrusion exercises improved tongue strength by 48% in older adults within 8 weeks, with direct improvements in swallowing function and reduced aspiration risk. Here's how to perform it. Sit or stand comfortably. Stick your tongue straight out of your mouth as far as it will go, aiming toward your chin. Now hold it there. keeping it straight and tense, not curled or relaxed. Hold for 10 seconds while breathing normally through your nose. Pull your tongue back in, rest for 5 seconds, then repeat. Do 5 to 10 repetitions, twice a day. If 10 seconds is too long, start with 5 seconds and build up gradually. If your tongue shakes or fatigues quickly, that's a sign it needs this training. You can also add resistance by pressing your tongue against a spoon or tongue depressor while it's extended. This exercise builds the foundational strength your tongue needs to perform every function well, from eating safely, to breathing clearly, to sleeping deeply. So why does your tongue affect so much? Because your tongue is one of the strongest muscles in your body relative to its size, and it sits at the crossroads of multiple critical systems. It controls your airway, supports your jaw and neck posture, assists with breathing mechanics, and directly impacts your ability to eat and speak safely. When your tongue is weak or poorly positioned, it creates a cascade of problems. Your airway narrows during sleep, causing snoring and apnea. Your jaw drops back, pulling your head forward and creating neck pain. Your swallowing becomes less efficient, increasing choking risk. And your breathing shifts from nasal to mouth breathing, which dries out your throat and weakens your immune response. Strengthening your tongue doesn't just improve one thing, it improves everything connected to it. You don't need to do all 5 exercises every day. Here's a simple routine that takes 5 minutes. In the morning, spend 2 minutes. Do 5 tongue-to-roof holds and 10 tongue push-ups. This wakes up your tongue strength and reminds your body of proper tongue posture. In the evening, spend 3 minutes. Do 10 side-to-side sweeps, 10 tongue curl and press repetitions, and 5 tongue extrusion holds. This builds strength and prepares your tongue to maintain proper position while you sleep. Do this routine 5 to 6 days a week. Within 4 to 8 weeks, most people notice better sleep quality, less snoring, fewer choking incidents, and even improved neck posture. Your tongue isn't something you think about, but maybe it should be. Because when your tongue is weak, your sleep suffers, your breathing suffers, your safety suffers. And when your tongue is strong, everything improves. You're not snoring because you're old. You're not choking because you can't chew. You're experiencing these problems because a muscle you've ignored your entire life finally needs attention. And now you know exactly how to give it that attention. If you're going to try even one of these exercises, leave a comment and tell me which one. And if this video helped you, share it with someone who snores, struggles with sleep, or has had a scary choking moment. Because the strongest thing about you isn't your tongue. It's your decision to strengthen what you didn't even know was weak.